Unit 2. Children and Women in Sports. After completing the study of the unit, you will be able to discuss exercise guidelines for different stages of growth and development, classify common postural deformities and identify corrective measures, recognize the role and importance of sports participation of women in India, identify special consideration relate to menarche and menstrual dysfunction, and express female athlete triad according to eating disorders. Exercise guidelines of WHO for different age groups. WHO defines physical activity as any bodily movement produced by skeletal muscles that requires energy expenditure. Physical activity refers to all movement including during leisure time, for transport to get to and from places, or as part of a person's work. Both moderate and vigorous intensity physical activity improve health. Popular ways to be active include walking, cycling, wheeling, sports, active recreation and play, and can be done at any level of skill and for enjoyment by everybody. Regular physical activity is proven to help prevent and manage non-communicable diseases such as heart disease, stroke, diabetes, and several cancers. It also helps prevent hypertension, maintain healthy body weight, and can improve mental health, quality of life, and well-being. WHO recommends for children under 5 years of age, in a 24-hour day, infants less than 1 year should be physically active several times a day in a variety of ways, particularly through interactive floor-based play. More is better. For those not yet mobile, this includes at least 30 minutes in prone position, tummy time, spread throughout the day while awake. Not be restrained for more than 1 hour at a time, example, prams, strollers, high chairs, or strapped on a caregiver's back. Screen time is not recommended. When sedentary, engaging in reading and storytelling with a caregiver is encouraged, and have 14-17 0 to 3 months of age, or 12-16 4 to 11 months of age, of good quality sleep, including naps. In a 24-hour day, children 1 to 2 years of age should spend at least 180 minutes in a variety of types of physical activities at any intensity, including moderate to vigorous intensity physical activity, spread throughout the day. More is better. Not be restrained for more than 1 hour at a time, example, prams, strollers, high chairs, or strapped on a caregiver's back, or sit for extended periods of time. For 1-year-olds, sedentary screen time, such as watching TV or videos, playing computer games, is not recommended. For those aged 2 years, sedentary screen time should be no more than 1 hour, less is better. When sedentary, engaging in reading and storytelling with a caregiver is encouraged, and have 11 to 14 hours of good quality sleep, including naps, with regular sleep and wake-up times. In a 24-hour day, children 3 to 4 years of age should spend at least 180 minutes in a variety of types of physical activities at any intensity, of which at least 60 minutes is moderate to vigorous intensity physical activity, spread throughout the day. More is better. Not be restrained for more than 1 hour at a time, example, prams, strollers, or sit for extended periods of time. Sedentary screen time should be no more than 1 hour, less is better. When sedentary, engaging in reading and storytelling with a caregiver is encouraged, and have 10 to 13 hours of good quality sleep, which may include a nap, with regular sleep and wake-up times. Children and adolescents aged 5 to 17 years Should do at least an average of 60 minutes per day of moderate to vigorous intensity, mostly aerobic, physical activity, across the week. Should incorporate vigorous intensity aerobic activities, as well as those that strengthen muscle and bone, at least 3 days a week. Should limit the amount of time spent being sedentary, particularly the amount of recreational screen time. Adults aged 18 to 64 years should do at least 150 to 300 minutes of moderate intensity aerobic physical activity, or at least 75 to 150 minutes of vigorous intensity aerobic physical activity, or an equivalent combination of moderate and vigorous intensity activity throughout the week. Should also do muscle strengthening activities at moderate or greater intensity that involve all major muscle groups on 2 or more days a week, as these provide additional health benefits. May increase moderate intensity aerobic physical activity to more than 300 minutes, or do more than 150 minutes of vigorous intensity aerobic physical activity, or an equivalent combination of moderate and vigorous intensity activity throughout the week for additional health benefits. Should limit the amount of time spent being sedentary. Replacing sedentary time with physical activity of any intensity, including light intensity, provides health benefits, and to help reduce the detrimental effects of high levels of sedentary behavior on health, all adults and older adults should aim to do more than the recommended levels of moderate to vigorous intensity physical activity. Adults aged 65 years and above. Same as for adults, and as part of their weekly physical activity, older adults should do varied multi-component physical activity that emphasizes functional balance and strength training at moderate or greater intensity on 3 or more days a week to enhance functional capacity and to prevent falls. Children and adolescents living with disability should do at least an average of 60 minutes per day of moderate to vigorous intensity, mostly aerobic, physical activity, across the week. Should incorporate vigorous intensity aerobic activities, as well as those that strengthen muscle and bone, at least 3 days a week. Should limit the amount of time spent being sedentary, particularly the amount of recreational screen time. Adults living with disability should do at least 150 to 300 minutes of moderate intensity aerobic physical activity, or at least 75 to 150 minutes of vigorous intensity aerobic physical activity, or an equivalent combination of moderate and vigorous intensity activity throughout the week. Muscle strengthening activities involve all major muscle groups, providing additional health benefits. Older adults should engage in multi-component physical activity to improve functional capacity and prevent falls. Increase moderate and vigorous intensity physical activity for health benefits. Should limit the amount of time spent being sedentary. Replacing sedentary time with physical activity of any intensity, including light intensity, provides health benefits, and increase physical activity to reduce sedentary behavior. It is possible to avoid sedentary behavior and be physically active while sitting or lying. Common postural deformities and their corrective measures. Our body is influenced by the environment or the forces of the environment, in which sometimes these powers become reason for the posture-related problems. Posture-related deformities are mainly due to habits, physical weakness, inheriting, unbalanced diet, malnutrition, lack of exercise, obesity, lack of awareness, etc. Mainly these deformities are of two types. 1. Functional deformities. In this type of distortions, muscles, soft tissues are affected. This type of asana can be cured by physical functions. 2. Structural deformities. In this type of deformity, the bone structure is affected. In improving these distortions, physical activity has no special role. This type of deformities can be corrected by surgery only. Various types of postural deformities are discussed now. Spinal curvature. This type of deformity is related to spine. This is a postural disorder. This deformity is caused by carrying excessive weight beyond capacity. In another way, we can say that weak muscles cause the formation of spine curvature. The normal lumbar spine is characterized by a moderate anterior hyperextension curve when viewed laterally. Although there is absolute standard for the determination of the degree or extent of the anterior convexity of the normal lumbar curve, there are three types of spinal deformities: kyphosis, hunchback, lordosis, and scoliosis, spine bending outside. Kyphosis. Kyphosis implies an increase or exaggeration of a backward or posterior curve or a decrease or reversal of a forward curve. It is also known as hunchback or round back. Depression of chest is common in kyphosis. Causes of kyphosis. Kyphosis is caused by malnutrition, illness, deficiency of pure air, insufficient exercises, rickets, carrying heavy loads on shoulders, unsuitable furniture, weak muscles, and habit of doing work by leaning forward, etc. Lordosis. Lordosis is the inward curvature of spine. In fact, it is an increased forward curve in the lumbar region. It also known as hollow back or sway back. It creates problem in standing and walking. The body seems to be stiff. The individual feels shame and inferiority. Lordosis can be corrected in an early stage. Causes of lordosis. Generally imbalanced diet, improper environment, improper development of muscles, obesity and diseases affecting vertebrae and spinal muscles are such causes which result in lordosis. In addition to these causes, not performing exercises and taking excessive food are also major causes of lordosis. Scoliosis. Scoliosis means bending, twisting or side rotating. In fact, these are sideways curves and may be called scoliotic curves. Scoliotic curve may be found in S-shape or simple or single curve to the left or convexity left is commonly called a C-curve. Causes of scoliosis. Scoliosis can be caused by a number of different things, but the main reasons are disease in the joints of bones, underdeveloped legs, infantile paralysis, and rickets. It may also be due to carrying heavy weights on one shoulder or unhealthy conditions like inadequate lighting arrangement at work. Knock knees. The knock knees are one of the major postural deformities. In this deformity, both the knees knock or touch each other in normal standing position. The gap between ankles goes on increasing. It is also known as genu valgum. The individual faces difficulty in walking and running. Owing to this deformity, they cannot be good players and even they are not selected in defense services. Causes of knock knees. Generally, the lack of balanced diet, especially vitamin D, calcium and phosphorus, is the main cause of knock knees. It may also be due to rickets, chronic illness, obesity, flat foot and carrying heavy weight in early age may be other possible knock knees. Flat foot. Flat foot is generally found among newly boys, but it is a deformity in childhood. The children with flat foot deformity cannot be efficient sports persons. Causes of flat foot. The main cause of flat foot is weak muscles. Weak muscles of the foot cannot bear the body weight. Hence, feet become flat or without arches. Along with this rapid increase in body weight, improper shoes, carrying heavy weight for a longer period are also the cause of flat foot. Round shoulder. In this type of deformity, the shoulders become round and sometimes they seem to be bent forwards. Causes of round shoulders. Round shoulders may be causes due to heredity. Sitting, standing, and walking in bent position may also result in round shoulders. By wearing very tight clothes. Sitting on improper furniture. Lack of proper exercise, especially of shoulders, may lead to round shoulders. To become habitual to press the chest. Bow legs. Bow legs is also a postural deformity. Approximately, it is opposite to knock knees position. If there is wide gap between the knees when standing with feet together, the individual has bow legs or genuvarum. In this deformity, the knees are widely apart. There remains a wide gap between knees when a bow-legged person keeps his feet together. This deformity can be observed easily when an individual walks or runs. Causes of bow legs. The main cause of bow legs is a deficiency of calcium and phosphorus in bones. Long bones of legs become soft, hence they are bent outwards. The chances of bow legs also increase when the children become overweight. This deformity may be because of the deficiency of vitamin D. Improper way of walking and forcing the babies to walk at very early age may also lead to bow legs. Sports participation of women in India. Women in India were not allowed to participate in sports due to the mentality that they would have adverse effects. After independence, equality of rights were granted and many Indian female players have won medals and competitions, establishing the name of India. The Government of India has implemented schemes and programs to increase participation in Indian women's sports, but many barriers remain, such as male-dominated society, customs, and religions. Main reason for low participation of women in India. The key reasons for low participation are physical reasons, low physical strength, 3 personal problems of women, psychological problems, lack of education, low participation of media and audience, personal safety of women, lack of female trainers, social problems, no equal rights for men and women, no financial help, lack of facilities, lack of encouragement from parents. 1. Physical factors. Physical conformation and reduction in fitness. Women's physical affirmation, capacity, and meritability are lower than men due to less participation in women's sports. Many women in India are not conscious about fitness. Female athlete triad. Women athlete triad is a symptom group in which bloodlessness, osteoporosis, and seasonal occasion are present. Due to these 3 conditions, women also participate in sports less. 2. Mental causes. Anecdotal education. Women lack fame because of lack of education. They remain futile in the baseless, hypocritical misunderstandings of our society, due to which they remain in mental stress. Media and audiences' indifference. Women are not raised due to indifference towards women's sports. Cricket is very popular in the media, but do we know the names of any one woman cricketer? Most students will not answer because women do not give importance to women's sports. The audience too does not like to see the role. The question of personal safety of women. This is also a major issue in our society that women will have the case. The question of his popular security is also becoming a major reason for lack of participation in women's participation. Lack of female trainers. Women are shy about taking training from men, and this also is the main reason for lack of women participation in sports. 3. Social reason. Do not treat women and men equal. Women are considered less in every way than men, which is not fair. Our society is called a male-dominated society, and in sports, it is considered as a man's ransom. For this reason, there is a reduction in women's sports. Financial assistance. Lack of financial support in women's sports. Sponsorship of women and scholarship is also very small, and money is required for international level competitions. Lack of proper access to facilities. Access to women is not appropriate to the facilities provided in the field of sports. Facilities like sports equipment, training and coaching are not generally provided to women compared to men. Therefore, women have less participation in sports. Do not get encouragement by parents. Girls do not get encouragement from parents to participate in the games. There is no incentive for them also. Hence, less participation is seen from women in sports. The spirit of society. Women of Indian society have negative thinking about participation in sports. Because our society is still considered to be a male society. In such a society, society's ideas towards women's players are disappointing. Many times it is said that why women do not go to the kitchen, where they should live. Therefore, women participation in sports is less. Suggest encouraging or improving the participation of women in games. 1. To make women aware about education. Women should be educated so that they understand the physical, mental and social characteristics and qualities. 2. By encouraging sportsmen. Women should give as much information about sports as possible so that women can participate in sports. Parents and other family members should also cooperate in it. 3. Appointment of women coaches. Women coaches should be appointed as much as possible. This will not hesitate in asking women to play, and they will get information about their mistakes so that there will be no errors in performance and performance will be good. It should be given financial support to participate in sports, which will lead to sports. 4. Giving financial assistance. Women should be given financial assistance to participate in sports, which will lead to more participation sports. 5. Family and society's cooperation. To increase participation in women's sports, the cooperation of family and society is very important. If the family and society will meet, then definitely women's participation will increase. 6. Managing balanced and healthy food. By managing and providing balanced food for women, we can also increase participation in women's sports. 7. Providing opportunities for competition in sports. By organizing competitions for women, participation in women's games can also be increased. 8. Eliminating cultural and social negativity. By organizing competitions for women, women can also increase participation in women's sports. 9. Broadcasting of women's games. Sports of women's players should be broadcast on TV. Their performances and achievements should be given special and specific encouragement from journalists and should be published with pictures of them, which will further encourage them to take part in sports. 10. Providing proper facilities. In the field of sports, Women should be given proper facilities such as sports grounds, equipment, etc., which will encourage sport. Special consideration, like menarche and menstrual dysfunction. We all know that many types of sexual differences are found in men and women. Due to this difference, women has to face some natural situations in his life which the male player does not have to. Number 1. Menstruation or menarche. The beginning of menstrual bleeding is called menarche. During the period of menstruation, teens feel mentally slightly stressed. There are many factors which affects reproductive health such as genetic, psychological, and psychological factors. In women, this process of menstrual lasts for approximately 48 to 50 years. Menstrual influences on female player. If a female player participates in sports with intense physical activity, then there is a negative effect on their reproductive system. Women's reproductive system is sensitive, due to which there are fertility irregularities in female players associated with sports related to intense physical activity. There is a slight decrease in performance levels of female players during menstruation. Female players often experience panic, anxiety, and stress in the state of menstruation. In the early days of this stage, the female players may complain of stomach discomfort and nausea. Causes. It is natural to have this action, because there will be no menstruation, then women cannot become mother. Lower circulation of luteinizing hormones increases the blood circulation in the uterus and blood is filled in white materials. More blood circulation leads to mucous membrane, and it is the bloodstream that comes out of the vagina during menstrual period. Number 2. Menstrual irregularities, like menstrual dysfunction. Menstruation irregularity means regular intervals of menstrual cycle, occurring at random intervals, or abnormally bleeding. Menstrual cycle is for 21 to 35 days for a normal female, in which bleeding takes place from 2 to 7 days. But when the menstrual period has increased by 8 to 10 days from time to time, early, prematurely, or more, then this cycle is irregularity of menstrual cycle. There are plenty of reasons of menstrual dysfunction such as genetic factors, high anxiety, miscarriage, mental stress, consumption of heavy medicines, deficiency of iron, and high-level training of women sportsmen. Effects of menstrual dysfunction on women athlete. Irregularity in menstruation causes deficiency in the body, causing the player lose physical ability and feel trembling in the body. Due to this, female players start feeling tired. In addition, the symptoms of irritability and anxiety are clearly visible in the players. There is a lack of nutrients in the body. Blood loss in the body. Contraindications of menstrual dysfunction on women athlete. All nutritional food should be consumed. Yoga should be done. Regular little activities should be done in the morning and evening. Get the doctor's advice and keep checking from time to time. Female athlete triad, like osteoporosis, amenorrhea, eating disorder. Female athlete triad is a syndrome which includes 3 disorders which women faces. It includes osteoporosis, amenorrhea, and eating disorders. This disorder affects 3 body functions that are connected to each other. These are energy levels, menstrual cycle, and bone mass. Osteoporosis. Osteoporosis is a type of bone disease in which the density of bone mineral becomes low in the bones. Due to the low density, the bones become so weak that there is a possibility of breakdown even after a slight shock. Women are more likely to suffer from this disease than men because they are found in low quantities of estrogen hormone. Amenorrhea. Anorrhea is the absence of one or more periods. The main reason for this problem in female players is to take low-calorie food according to high-intensity exercise and physical needs. Taking low-calorie intake of women's physical requirements as needs reduces the number of hormones that control menstrual cycles. Food disorders or eating disorder. When a person starts eating more or less than normal, it is called eating disorders. This is a type of psychological disease that causes disturbances in the regular diet of the sufferer. Due to its physical health, its mental health also has negative effects on the person. Two types of eating disorders are A. Anorexia nervosa and B. Bulimia. Anorexia nervosa. There are mental illnesses which are found to be the most in early or middle adolescence. The person suffering from this disease greatly reduces the amount of food for the purpose of reducing their physical weight. Things seem to be lean to sight because of the reason. People suffering from this problem begin to adopt various types of inappropriate methods to reduce their weight. The heart and the anus are damaged by this disease, and if this disorder is not treated at the time, then it may also be fatal. Bulimia. Bulimia is also eating disorder mental illness. The person suffering from this disease first consumes excessive food and the second moment they try and begin to lose weight. For this they follow methods such as vomiting, taking enemas, medicines and fasting after meals. This problem is more common in women than men. Bulimia is of two types. A. Purging bulimia. In this type of disorder, the person deliberately vomits or uses enema after food. The main purpose of this type of action is to remove food from the body even before digestion. And B. Non-purging bulimia. In this type of disorder, the person seeks fasting, strict diet or excessive exercise to burn maximum calories.